You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, general dentistry. For those of you that haven't been to the dentist in a long time, Dr. Pocock says that with his practices and their philosophy, that small improvements can make a big difference in your life, and dentistry doesn't have to be scary. Dr. Pocock, welcome to the program.
Hi, how are you?
Now, I paraphrased a little bit about what you came on the show to do, but for people that don't know you, tell us a little bit about your practice. I guess you have 3 practices.
We do, for the time being, we have 3, one in Billings and 2 others in the surrounding areas. And our philosophy is just to increase access to care and make available to patients most of the procedures that you get. We find that most patients don't like to go to a specialist. They don't like to have to go anywhere other than where they're at in our location. So we've tried to increase the procedures that we do from just general dentistry to endodontics to orthodontics, and even placing implants and restoring implants. And
okay, good. Now, who is your typical patient in your practice? Because you do mostly general dentistry. I guess you do everything, fillings and... We do. Just the other day I was in the practice and had a patient in the chair that was a small child that was a Medicaid patient, and I was pulled away to do an exam from one of my hygienists, and I sat down with the next patient for the exam, and it was a medical doctor from the local area. So we see a wide range of everyone in the practice, and we tend to do a little bit of everything. Some high-end things, from veneers and crowns and cosmetic things to just your standard fillings for kids and adults. So we like to do a little bit of everything. So you were talking about access to care and prevention. I guess a lot of people put dentistry off, right? Especially guys, right? They wait until the last minute, you say. Yeah,
it's so funny. A lot of times, in fact, just yesterday I had a lady call, and my receptionist was in the back, and so I ended up answering the phone. And this guy's wife says, "My husband's hurting. He needs to see a dentist. Can he get into you?" He says, "Yeah, sure. Let him come on by." And it's so funny because I think if we weren't married, most guys would never go to the dentist. Most appointments are made by our wives.
Is that right?
It is. It's true. Yeah.
Is that right? They got to push them over to the dentist.
They do. But having said that, there's a lot of people, whether they're male or female, who are just afraid to come to the dentist. They've had bad experiences when they were a kid. It set them off, and they just, anytime they think of a dentist, they associate that bad experience. And for me, I look at my experience as a kid with my phenomenal dentist who I grew up with that I just love to death, and that's what I want to.
That's how you do it today.
That's what I try. Yeah, I try.
And we've had discussions, and without going negative, we want to be positive, but you really think it's important that the public knows that watches this, that your office is not the kind of office that pushes things on people.
Yeah. We're all about choices.
Elaborate on that.
Well, we're about choices, I think.
Because you have frustrations. Sorry to interrupt you.
I do. No, that's fine. I do. I have frustrations, but I just think that people are intelligent. They can make their decisions as long as they're educated. I think that, there's a lot of dentists out there, and I don't want to get negative, a lot of dentists nowadays that only carry white fillings where, silver fillings have been around forever. In fact, while we're talking, you probably haven't noticed, but I've got 5 or 6 silver fillings in my mouth. And
so silver fillings are less expensive than the white fillings?
They are, and they tend to last a lot longer too. You might get 30, 50 years out of a silver filling, where a white filling, 10 years is
it double the cost?
No, it's not double, but it's...
Like 30% more?
Yeah, roughly.
So your office offers that?
Absolutely.
Because it's affordable.
We offer the choice, and it's phenomenal to me. When I worked in Denver, we didn't offer silver fillings. It was just, white was what it was. I always thought that silver was bad, and I kind of had this idea in my mind that, it's going towards white fillings, but I got thinking, I realized, I've got tons of silver fillings in my mouth. There's been no harm to me. I think it would be hypocritical not to offer them to patients, because I believe in them.
So in your office, then, so you offer the least expensive options? But you also offer...
Yeah. Usually...
The other two? Do you offer the other two? White fillings if they want it?
Oh, absolutely. Absolutely. Okay. I always give people the option. I don't have anything negative against white fillings. I just want people to know that, here's option A, here's option B. There's pros and cons to both of them. Now you make the decision. And what I've found in the majority of the time, patients will choose the silver fillings when they're educated and they know the difference between them.
So you're not afraid of them, the mercury or things like that?
Absolutely not. No, absolutely not. There's been lots of studies done. The real scare is the mercury, and the mercury getting out and being toxic to the patient. Anytime you talk about anything toxic, though, you have to realize that anything can be toxic to us. It's just the levels that we have that we're exposed to. So a typical silver filling in the mouth, it might release in the form of a gas very small amounts of mercury over a long period of time. If the toxic levels are here, the amount of mercury that's released is probably here. So there's a big range, so a big safety gap there.
Okay, so what else? What else in your office do you have to make it affordable? Access to care.
Well, we do a lot with insurances. We network with a lot with insurances to make it available for patients who just can't afford it. You know, economic times are tough, and people really rely on those insurances, those other third-party forms for payment. So, you know, we're in network with Medicaid, with all the major insurances to help them with the costs to make it available for them. There's so much need out there in dentistry. There's so many people who just don't go regularly, don't go consistently.
Is it true, by the way, somebody told me that, I don't know, maybe it was you that told me, but for every year you put off dental work, that it ends up costing you about $1,000 a year more if you keep putting it off and putting it off and putting it. Is there any truth to that, you think?
Oh, absolutely. You know, if I can tell you just two examples that I just saw recently. One was an individual, he's probably in his 50s. Over time, our teeth wear down. You'd be amazed at the forces that go on in our mouths. While you're conscious, the amount of pressure that you can consciously clench on your teeth is about 200 pounds.
Right?
If when you go to sleep, those mechanisms to stop that go to sleep as well. So you can put as much pressure, up to 1,500 pounds of pressure on your teeth. So there's a huge amount of forces and weight. Over time, they're going to wear out. They're going to grind down unless we take care of them, unless we do the things that we need to. I saw a 50-year-old gentleman just the other day. His teeth were extremely worn out, and he was at the point where we were really out of options. We either could do a denture for him, or we could crown every tooth in his mouth, and it's going to be tens of thousands of dollars. And that's a hard conversation to have with someone, but if it's put off for so long, you kind of get to that point. Another patient I saw the other day, she was 91 years old. Okay. Same situation.
91?
91, absolutely, yeah. And I think the fountain of youth is in Montana because she did not look 91, and I think half our patients don't look half their age. Montana's phenomenal for the patients there and their age. But she was 91, came in just as alert as anybody I've ever known. But she, over the years, had worn those teeth down. They had a lot of decay in them, and she was just at the point where we had no other option but to do a denture for her. So it's tough to see that. It's tough to see someone put it off for so long.
So with you, because you guys do dentures there,
absolutely,
but you also do dental implants. Mm-hmm. Do you always give people the options of the cost of the denture, the cost of the dental implants?
Yeah, and the nice thing about it too is, you know, you can get your implants later on down the road after you get your denture and take the same denture and attach it to those implants. That's usually an option. And so we want to make people aware of those things because, you know, not everybody's made out of money, and you need that's a consideration.
So many people don't go to the dentist, like you say. What's your take? Is it the pain they're afraid of? They don't think it's necessary? You know, and what can you do right here to kind of get people to start coming in, I guess, every 6 months or whatever?
You know, it's really education and awareness. Out of sight, out of mind. You know, I don't hardly know what's in my mouth. I don't know where the fillings are, and I don't know where the cracks are in my mouth. And I think people just aren't aware of what's going on. We look in so many mouths every day and see decay and see cracks and fractures and problems and issues that we face on a regular basis, but people have no clue that they're there. And so I think an awareness is a big issue, but fear and pain.
I mean, nobody wants to lose all of their teeth, right?
No, absolutely
nobody.
Not.
And it all starts somewhere. So I guess your goal as a dentist is to get them in early. Mm-hmm. But that's the challenge.
It is a challenge. It's a difficult challenge. But what I'm amazed at with a lot of patients in some of our little practices, these are little farm communities, where, you know, they come in consistently every 3 months, or excuse me, every 6 months, and their problems are very few, far in between. But then we'll get that phone call from the one patient who hasn't been in for 10 years. They come in and it's amazing what can happen in just a short amount of time.
You say that we talked in my green room that people will come in, they've been to the dentist in 5 years, 10 years, 15 years. and they're embarrassed.
Mm-hmm.
They may say, "Doctor, I bet you've never seen anything this bad."
Yeah, it happens.
Is that
a lot.
right?
Yeah, we hear that all the time, and very rarely do we ever see something that we just think,
What do you
"Oh my
tell
gosh."
them? What do you tell them when they say things like that?
You know, we try to assure them that it's not as bad as you think it is.
So, can somebody be too far gone?
No,
I mean, you guys
not.
handle complex stuff too.
We do. We see complex things, but it takes a long time to get to the point where you're too far gone in dentistry. But it's those small things that make a big difference. If you come in consistently, we catch a little filling before it gets to become a big filling, then it's a cheap, quick, easy fix, rather than having to get a root canal, a crown, a post, a core, all sorts of things on one single tooth. So it's coming in consistently, regularly, so we can catch those things when they happen, because it does happen. There's so many things going on in our mouth. There's so many forces, and to be honest with you, there's the diet nowadays and the way people take care of their teeth. Some are good, some are bad, but there are always things that happen and always things that come up. So it's just those simple, quick fixes that can make a huge difference.
Now, we're just about out of time, but when you were driving over here, on your way to the studio, and you probably said to yourself, "I really want to get this point across," what would that be?
What I'd like people to know, and what I'd like for them to believe, is that they can trust us and know that we have their best interest at heart, that they have options. Things don't have to be done that day, but to come in and let us take a look. Let us make sure that you're not heading down a road where we have to do a really expensive treatment if we don't do something soon. But the most important thing is for people to trust that we have their best interest in heart. We're going to give them options, and then they can make the choice.
I want to thank you for coming on the show. Interesting stuff. Now, we have your partner, Dr. Townsend, coming on the show, talking about controversies in dentistry. What could you tell us about him?
He's not much to look at, but he knows what he's talking about. He's a good guy.
That's very funny, by the way.
Thank you.
Okay. You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, misconceptions in dentistry. With us, we have a dentist that wants to lay some of these misconceptions and controversies to rest. With us, we have Dr. Remington Townsend. Dr. Townsend, welcome to the program.
Thanks. Pleasure to be here.
Now, before we get into today's topic, and I have a lot of hot topics, from metal fillings, mercury in the mouth, to Zoom whitening, to teeth in a day, and lasers, and all of these things, and you have strong opinions about all of those things. But let's start with your practice. I guess you have practices spread all over Montana.
In several locations, we have some practices in Hardin, Montana, Laurel, and in Billings.
Where do you work out of?
I work in Billings.
Billings? Okay, good.
Great location.
Your topic is very unique. I don't think we've ever talked about it on the show, but misconceptions or controversies in dentistry. And so let's kind of jump right in and talk a little bit about metal amalgam fillings or mercury fillings. Here in California, boy, there's some really bad press about these. And dentists, have even been on my show, bad-mouthing mercury fillings.
Yeah.
What are your feelings there?
It's interesting that you asked that. It's kind of a roundabout answer to a very direct question. But I'm going to ask you a question. Have you ever heard of dihydrogen oxide?
I've heard of it. I don't know what it is.
It's DHO. It is the most dangerous chemical on the earth, causing more deaths in China. 500,000 people in the last century in China have died from it.
Okay.
That's more than anyone with heroin addiction or anything like that. In the United States, in the 21st century, last year, 4,000 people died from DHO.
Okay.
It's a dangerous chemical. It's used as a fire retardant. It's used in nuclear power plants. Unfortunately, sometimes it's added to the food that we eat.
Okay. So what does this have to do with mercury fillings?
Well, that's interesting. Dihydrogen oxide, when it's also in its solid state, can be dangerous to human limbs. People have lost limbs due to this product.
Okay.
Do you know what dihydrogen oxide is?
What is it?
H2O. It's another compound name for H2O, water, simple water. So in the world today, we can take a simple product that has many good applications, and I can twist it and I can turn it and make it sound as if it's the worst product.
So you think mercury is not something you have to worry about? It's
leaking. Been proven.
So it's not leaking out into your body and causing neurological problems and all the detoxification problems?
Well,
you
there
think
are
it's overblown?
some. I do.
Think it's overblown?
Well, the studies have shown that it's overblown.
Okay.
There are studies after studies. The FDA has said it's safe. The American Dental Association has said it's safe. And what actually leaches out, now they used to say it was inert, completely inert. There's some vapors that come out, about 0.08 to 0.2 micrograms per filling.
So it's nothing to worry about, in your opinion?
No, I mean, dentists for years have been using in their dental practices for 20 to 30 years. 8 hours a day of high concentration of mercury vapor. No side effects.
Okay. Well, let's move on to why we bring that up in the first place. Because you say that if you don't offer that, it may be a disservice to your patient, because the other alternative, these white fillings, are more expensive.
They are.
Is that right?
They are. Well, what's the number one reason why people choose the white ones? The number one reason.
It looks good.
It looks good.
Is that the reason?
Yeah.
Okay.
Did you know what the fastest growing segment of the population in the United States is today?
What is it?
It's women 100 plus years old. The second fastest growing population
You're filled with these great statistics.
is women 90 and above. So when you look at them and you tell them, hey, aesthetics is really important here. Or do you look at them and say, let's give you something that's going to last, that I can put in there, that's inexpensive, and has been proven to work well for centuries.
So you like metal amalgam fillings simply because they last longer,
well,
and they're strong.
It's not that I love them. I mean, they're ugly.
But for the back teeth, you like them?
Yeah. I mean, they're great. They're a great tool.
And they're less expensive.
Mm-hmm. And the minute we take them out of our tool belt, that's when we get in trouble. The minute that a doctor can look at someone and say, I don't use those because they're bad. Well, I can tell you 1,000 reasons why tooth-colored fillings are bad. They have byproducts in there. They're
the
plastic.
adhesives, I guess what the adhesives, you don't like those adhesives.
No, it's not the adhesive. It's the plastic itself. It's
Okay.
it's a carcinogen. And BPA, which is a byproduct, when it comes in contact, what happens is you place a filling. Saliva comes in contact with it. And this byproduct called BPA is released. It's known in children to cause mood changes, irritability. It's been advised by the FDA.
But once it's hardened in these plastic sealants, or these sealants, isn't then that no longer a problem? Just like mercury, when it's hardened in the metal?
No, that's the problem. It's once it's set up and it comes in contact with the saliva that this byproduct is released.
So you think those may be more dangerous than the mercury?
No, what I'm saying is there isn't a great product. Everything we have has a negative side. The problem is that people don't have all that information that's given to them.
On your own family members, would you recommend the metal amalgam for the back teeth that don't show?
It depends on the location.
If it's like on the back teeth that don't show, you think?
Actually, it depends on what they want. It's more important.
Good for you, good.
Yeah, it's more important that the patient gets what they want. So you have to
lay
out.
At least give them that option.
Right.
Let's move on to the next one for the sake of time. This like 1 hour fast whitening in the dental office. You're not a big fan of it. And don't hold back here.
It's a great product. The problem is that the light has been shown not to.
This is where you get in the chair and they put a big light on you.
Yeah. The light doesn't do anything.
In an hour.
The light doesn't do anything. No. It's been proven that it doesn't do anything. Time in and time again. And we're still waiting for it to actually do something.
Is it more expensive, this 1 hour fast whitening?
Yeah. And so, it's funny. I actually had a colleague that was, dumb enough to admit, he's like, I know that it really doesn't help. But it's
This is what dentists talk about behind the scenes.
Yeah, this is what one of my colleagues actually had the gall to tell me, hey, listen, it's just easier to sell it because it's expensive when we put a light with it.
Okay, but for the sake of whitening and for the sake of time, you're saying that, and I don't want to put words in your mouth, that just whitening trays are just as effective, if not better?
Well, it really depends. That's, again, where we have to find out what our patient wants and needs. If they're going to a reunion and they need their teeth white today, you probably want to do the in-office bleaching.
Okay, there you go. Okay. So there is a good application.
There is a good application, but the downside is it rebounds a little bit quicker. So it gets whiter, and then it drifts back into the not as white stage again.
Interesting.
So you can spend a lot of money and get your teeth white really, really quick and then have it rebound, because then we have to send you home with home whitening gels. Or you can save yourself some money, do it a little bit slower, and have a better, longer result. And it's information like that patients just don't know.
I love your enthusiasm. We have to move on down here. This is good. Teeth in a day. Getting teeth, the same day teeth, like these machines that mill the teeth right there. Even that, you say, kind of bugs you or frustrates you, or you can describe it.
Yeah, you know, in a fashion, it's great. I mean, dentistry has become an incredible engine for development and growth in the world today.
But with teeth in a day, what's the problem?
Well, see,
because they're doing it in a day.
They are. The downside is they're ugly. You can't get a great product from it. You know, granted, the science is coming, and we have to have people that are buying it and using it so that greater growth and development can happen. But sometimes I think in our effort to make things fast and easy and to make more money quicker, we forget all about the patient, which is and should be our ultimate goal.
So you're saying that the crowns that you could, and by the way, people need to know this is a real interview. I'm not endorsing you. I'm just asking the questions. But you say that they don't look that good when they're done that quickly. Is that right?
I have seen 1,000 of them.
Okay. So you're saying if you just wait a week or 2 weeks or sending it out, you get a better looking tooth.
You can.
That's more natural.
Mm-hmm. And the problem is you can have some dentists that have done a gazillion of these. I mean, just so many of them. But the learning curve on it is huge. So in order to get something that is perfect and looks great, it takes so much time that you start to wonder, was it worth the sacrifice of all those patients before?
Okay. So there are dentists, though, that know how to utilize those machines to do it right.
Oh, absolutely. But it's a tough technique.
Okay.
And is it ever as good as a lab one?
Tell me, what do you think?
It's coming.
Well, so you think it's not there yet?
I don't think it's there yet.
Okay.
I wouldn't put it in my own mouth.
Is it less expensive? You wouldn't. Is it less expensive than what you do in your office?
It for the dentist.
I mean, are you less expensive?
It costs me more to do a lab version than it does the doctor that does it in office. It's actually quicker, easier.
But they can make more money if they own the machine.
Yes.
Okay.
Yeah.
But those machines are over $100,000, right?
Yeah, but but you know, you can pay that's a year and a half of dental lab fees.
Okay. Well, good for you. Good. Okay. The other thing, lasers.
Yes.
Big push for lasers to get rid of gum disease. I've had this procedure done on myself. So I'm dying to hear what you have to say about this.
Lasers are great. They've been around for 35 plus years. It's phenomenal where we are with them today. The downside is that there's conflicting literature that says that lasers don't cause any problems and lasers do cause some problems. There are some irreversible consequences that they actually have on root structure. A change in temperature can destroy the cells, causing external and internal resorption of roots. They've been shown to not eradicate bacteria.
So you don't like lasers for the treatment of gum disease like bleeding gums, bad breath.
They're great for gingivectomies. That's removal of tissue right around the tooth.
But not for killing this bacterial infection?
No, it doesn't work. And studies have been shown it doesn't work.
All right, okay. Well, this is controversial, that's for sure.
Yeah.
And
but you know, it'll get there.
But knowing you're going to come on my show to talk about controversies in dentistry, why talk about this topic? What's your goal here?
You know, I
mean, what do you want the public to know about your practice in your office?
See, and I think that's the biggest key, to be honest with you. Is in my office and with the doctors that we associate with in our practices, it's all about educating the patient. Again, with the water thing, with H2O, I can tell you that there are 1,000 things that are wrong with it, but yet it's absolutely essential. So in the dental profession, it's important that we teach our patients what the pros and cons, the good, the bad, the ugly are, and then allow them to make the decision. I don't want to push one way or the other. Tooth-colored fillings, my mom, she wants them. That's just great. But there are other people that don't. So when you present them with the options, they get to pick, and they ultimately get what they want.
Do you think, now we're talking about in the green room, and I was getting the impression, correct me if I'm wrong, that you think there's a lot of overselling going on across the U.S., not just in Montana, but across the U.S., with dentistry with patients.
Yes, I think
you believe that?
I do. I think our profession has taken an absolute nosedive when it comes to the ethics. We are overselling, overdiagnosing, over-treatment planning, and for what? You know, it's different for each case, but most of the time it's for money.
Anything we haven't talked about? And final message that, well, obviously, look, you know, you wanted to come on my show and say, hey, look, we're not a practice, and I'm paraphrasing slightly, but we don't oversell our patients. We give them what we think is best for them.
Yeah.
Like we would do to our own family member. You know, and you said, by not offering metal fillings, you're doing a disservice to patients.
Yeah.
Because if you're only offering the more expensive option, you may lose a few patients that are walking around when they need a filling and they're not getting one, right? So what do you say to the patients? Final message, somebody hasn't been in the dentist in a long time, and maybe that's one of their fears, being pressured into something they don't need, or they're worried about cost. What do you want them to know about your practice?
I want them to know about every doctor,
Okay.
or even about our practice, that find someone that cares, that wants to treat you the way that is best. And you know, that's difficult because everyone has their own little idea of what they think is best. But scientific-based literature and why we do things is a big reason why you should do things. My mom used to, you know, she told me a story about this lady that used to, when she cooked her chicken, she'd take off the chicken legs. You know, so the daughter always took her chicken legs off. And then her mom came by and said, "Why are you taking your chicken legs off?" Well, and she's like, "I don't know, you always did it." Well, I did it because our oven wasn't big enough. So, you know, where was I going?
So you question, I guess, that in dentistry, that oftentimes that you're doing things a certain way because that's the way it's always done.
Yeah, or you do it because you think it's the best thing to do.
Okay.
You know, when science, you know, you're like, well, the people that own the lasers and the people that are selling them, they tell me it's good. You know, you have to do a little bit of research. You have to know what you're getting. I used to have a dental professor that would walk around the denture lab, and he says, knowing your materials is key to success.
What if somebody says, this guy's just old school?
I probably am a little bit. But it's better to have scientific-based answers than this is what I think.
We're out of time. This is good. Great stuff. And so if somebody hasn't been to the dentist in 5, 10 years, 15 years, come in. Meet with you, face to face.
Yeah.
And you're going to give them all their options.
That's exactly what we'll do.
All right. I want to thank you for coming to the show.
Thank
Very
you.
interesting. Good for
Pleasure.
you. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview online, you can visit our website, put in Montana Dentist, or you can put in Dr. Townsend, and you'll find him there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.